Hello, this is Dr. Emre Karadeniz, hair transplant surgeon from AEK Hair Clinic, Turkey. I'm going to talk about hair transplant pricing per graft versus per session. I think this is an interesting topic. The traditional way in the Western world to price hair transplants is to price per graft. I'm going to talk about the problems I see in this pricing method. Now, initially, it looks like, the more grafts you do, there's more work, so it looks like it's normal to charge for the number of grafts you do. It's like buying, let's say, an ounce of apples or oranges. But I'm not sure if that's entirely true, and here are the reasons why. Now, there's a technical side and there's a philosophical and ethical side to this problem. The technical is that when we do FUE, how do we take more grafts? So, how do we take more grafts? The way to take more grafts in FUE is to do two things. One is to do it faster. If we do faster, we will do more grafts. Now, if we do it faster, we actually damage more. So we cause more tissue damage, more graft damage and wastage. So if we're paying per graft and we're going to do it faster in order to give you more grafts, we're actually increasing the damage and wastage. So you're paying more to get more damage. So as you can see, that's not to the patient's benefit. The other way to increase the number of grafts, not by time but by area, is to do closer punch holes. So if you do more closer punch holes, you'll get more grafts. Now if you do too close punch holes, you cause one, more scarring, and two, you decrease the donor density significantly that it may be depleted and look moth-eaten. So you're destroying the appearance and the aesthetics of the donor area. So the second way of getting more grafts by making closer punch holes doesn't benefit the patient either. So you're paying again for something that doesn't benefit you. The third way to get more grafts in FUE is to use a smaller FUE punch, a smaller surgical punch. Now this may sound good at first, but if you use a smaller FUE punch than needed, that's a punch that is smaller than the width of your follicular unit, which will not be able to take that follicular unit in, you're going to cause more damage, more follicle transections if the punch is too small. So the third way of doing more grafts is using a smaller punch also increases the damage and wasted hairs. So as you can see, there are three ways surgically in FUE that brings us more grafts, which none of them are in the patient's benefit. So by paying per graft, you are encouraging the clinic to do something that is not in your benefit. Now in strip surgery, FUT, you remove a strip. So again, there's ways to take more grafts. One is you take a wider strip. You take a wider strip than you can actually take, you're going to close the wound under tension, and this is going to be much more painful, difficult to heal, and you're going to get a worse scar. I've seen, let's say, on public forums where the patient had a huge number of 4,000 graft strip taken, and the surgeon was unable to close the wound, and he had to leave it open, and the patient received a 2 to 3 finger thick scar and a very bad healing period. That was because the agreement was on grafts. By taking 4,000 grafts, the clinic kept their promise. There was nothing in the agreement telling if the wound is not closed or the scar is poor, there's going to be a penalty for the clinic. No. Agreement is for grafts, so the agreement is kept. The other thing in strip is that let's say we take a strip, which is a normal strip, proper closure, no problem there. But in order to get more grafts, we can overcut, or we call that subdividing follicular units, to make more single and double haired follicular units, so we get more grafts. So let's say we have a strip containing 6,000 hairs. Theoretically, we could create 6,000 grafts with 1 hair each. So, or we could do 2,000 grafts with 3 hairs each. So for the same strip with the same amount of hairs, you would pay 3 times more when the clinic overcuts or subdivides the follicular units, and so you pay 3 times more for the same coverage and same number of hairs. So as you can see, again, it's not to your benefit to pay for the number of grafts. And the other thing related to this, it's proven in scientific studies that skinny grafts, which are predominantly single-haired, survive less than chubby grafts. So not only you pay more for the same amount of hairs, but you get poorer growth. So as you can see, none of that is to the patient's benefit. So these were all surgical reasons why paying for the number of grafts is not to the patient's benefit. Now there's ethical reasons too. For instance, if you pay for the number of grafts, the chances are the clinic will be encouraged to offer you a higher number of grafts, so they make more money. So chances are you'll be advised to use up more of your donor hairs that perhaps you didn't need that much. There's clinics that will recommend 4,000 or 5,000 grafts, whereas 2,000 would do. So as you can see, there's an ethical problem. And the other ethical problem I have in mind is, for instance, let's say you have a certain budget. Okay, you have $5,000. In our clinic, we charge $5 per graft. Okay, so we find out that your budget is $5,000, and in this case, you can afford only 1,000 grafts. So the clever salesperson in the clinic is going to realize that there's no point in recommending you 3,000 grafts, even if you do need it, because he knows you're not going to be able to pay, and you're going to run to another clinic that's cheaper and recommends, he says you'll need 1,000 grafts. And you'll make an agreement thinking that that's within your budget, but you're getting an amount of grafts that's too small for your situation, and you're going to get a result that's not satisfactory. From an ethical point of view, this clinic should have refused you because you have insufficient funds. But because you're paying per graft, they're okay, free to give you the number that you can afford. So for all of these reasons, I believe paying per graft is harmful and unethical. Paying per session, on the other hand, is more healthy, because you're just paying for the performance of the clinic that you believe they're going to do their best. Now, a quick question you may ask: what if the clinic does deliberately less number of grafts because they're too lazy when the agreement is on per session? Yes, they can do that. But this clinic will be judged with the results they provide. So if the clinic keeps doing less number of grafts than needed, they will get poorer results and less coverage, and then other patients will look at that and say, we don't want to go to this clinic. So as you can see, if the clinic does that, they will not be able to get away with it. So paying per session is much healthier than paying per graft. But there's one extra thing I have to say, is that in Turkey, surgeries, 99% of surgeries are charged per session, but not for an ethical reason. It's because in most of these surgeries, there's no doctor and technicians are used for the surgery. And then it becomes unnecessary for the clinic to charge for grafts, because it doesn't matter for the clinic to tell these technicians to take 2,000 or 4,000 grafts. It doesn't matter for them. So they just have a fixed fee. So the only exception that you have to look at is if a clinic is charging per session, try and make sure this is not a technician-only clinic with no doctor in the procedure, because they are charging for the session not because they're too ethical, it's because there's no doctor in the procedure. So I hope this video comparing pricing strategies in hair transplants, charging per graft compared to charging per session, has been helpful. Thank you for watching this video, and I hope to see you in the next educational video. Goodbye for now.